So I'm Manny Jimenez. I'm the Executive Director of the International Initiative for Impact Evaluation, or 3IE. I'm an economist by training. I was born in the Philippines, but spent most of my life in North America and my schooling there as well. I joined 3IE about 18 months ago as its second executive director. But before that, I was for about 30 years with the World Bank as an economist, doing various things. The first half of my career there was in the research department, and then I moved to being the head of the World Bank's operations in the social sectors in Asia, and then my last 3 years as director of public sector independent evaluations at the World Bank. Before I joined the World Bank, I was in academia, teaching economics at the University of Western Ontario. So my career sort of spans the range of development activities, because I always focused my research on the problems of poor countries. So 3IE objective is to encourage the generation and use of evidence in policymaking in developing countries. It was set up about 7 or 8 years ago now in response to a challenge that a report presented to the world, which was the Center for Global Development asked in a provocative title, after it was called "When Will We Ever Learn?" Because their premise was after 60 or 70 years of development experience, the number of studies that were available that were based on rigorous evidence was very, very small. So it's a good question that you ask, because the whole purpose of my organization is exactly to try to fill this gap between what people perceive as the need for evidence to inform decisions and the need and the supply of it. So you asked, why is it important? I think there are two very important. There are two reasons why this is so. One is that in building evidence for the impact or the effectiveness of an intervention, such as building more schools or promoting health in countries, it's rather difficult to link cause and effect in a rigorous way. And this is because, let's say we have a training program in which you want to find out if the training program is effective in raising the welfare of people in a certain community. It's very difficult to know, for example, even if you find that the training program help improve the well-being in the communities that receive the training, okay, from the time that it was before it received the training. Do you know whether or not that was because of the program? It could be that there was an overall increase in income in the country, so that the improvement was not due to the program at all. So it's very hard to establish cause and effect. It could also be that the training program attracted people who were more motivated. So the changes that you see may not be due to the program, but to the fact of the inherent motivation of those who participate. So what impact evaluation does is it tries to apply rigorous methods to make sure that you can measure that the observed changes in outcomes can be attributed to the intervention itself. And there are various methods to do that, including randomized control trials, but also non-experimental methods. So when you do it this way, I think that there are examples in many countries where the rigorous evidence has helped to sustain good programs. Let me just give you two examples of this. The conditional cash transfer program in Mexico was one of the first programs of its kind. And what this program tried to do is to convince Mexican parents to keep their children in school longer and to convince them to get proper health care for their children by giving them income, okay, but conditional on their having met those other requirements, keeping their kids in school and getting health checkups. So when this program was first started, it was controversial because it was replacing other programs that I believe in Mexico it was the tortilla subsidy program to help poor families by subsidizing the price of the staple commodity of food. It was very expensive because everybody got it, and it just lowered prices artificially for tortillas. So this program was very targeted towards those who needed it, but also it tried to meet the development needs of Mexicans. Now, the Mexicans didn't know if it was going to work, so they actually designed an impact evaluation, several actually, to see whether or not as a result of families getting this subsidy and meeting those conditions that education levels were higher, nutrition was better, and health outcomes were better for the kids who got it. And they did it in a randomized control trials in which they compared Mexican areas which selected randomly initially to receive the program with those which didn't get it. And what they found was, yes, those indicators were higher for those areas that received the program. Now, as a result of this, I think a lot of people believe this is one of the reasons why this program was sustained, because since it was designed, it has undergone through 3 changes in government. And in each time, the results of the rigorous evaluation were presented to the incoming administration. And the incoming administration then saw that the program was working. They didn't want to dismantle it, even though it was the program of the previous administration. What they did was change the name. So what was Progresa before became Oportunidades, and now is Prospera. So that's just one example of a case where a rigorous evaluation helped because this established cause and effect, and it had a lot of validity that the succeeding governments were not able to, had to take on board in deciding whether or not to continue the program. So there are several other examples, but it is a continuing challenge because it's very hard to convince governments to base their decisions on evidence. Okay, as I mentioned, one challenge is actually that how do you make sure that we not only get some good evaluations done, but we change the culture of decision making in both donor agencies and in countries so that they are more evidence-informed, making more evidence-informed decisions. This is an ongoing challenge for a couple of reasons. One is that I think the capacity of those who want to use the evaluation to understand them and to absorb them is still limited, so there's a continuing need to raise their capability to do this and to demand more of this. Another challenge is sometimes when a result is seen, there is a temptation to apply them immediately to other settings. Well, you have to be very careful because just because something works in Kenya doesn't mean that it will work in India or Indonesia, and that you have to in fact, take the good ideas and then adapt them to the local setting as opposed to just taking them outright. So that's another challenge, is how do you transfer lessons from one place to another? A third challenge is that the capacity of people from developing countries to do their own evaluations is still limited. So we want to make sure that evaluations are done not only by researchers, good researchers from developed countries like Japan, which is excellent that we're able to do this, but that also more developing country researchers are being included. Finally, despite the fact that over the past 10 to 15 years, there are more impact evaluations that are being done now than ever before. My organization, for example, has been tracking how many there were. Now there are about 2,500 a year being published, whereas just 15 years ago there might have been 40 that were being published. So there's more and more. There are still big gaps in our knowledge. There are certain areas where there are almost no impact evaluations or very few. Very important areas where big investments are being made, such as infrastructure, environment, and governance, are just some of the areas. So there's still big gaps out there, and it's very important to start filling them.